Hi guys, my name is Aleah Gunthrope.
Hi everyone, my name is Gracen Brown.
Hello, my name is Ginawy.
Hi, my name is Cara Fratello.
And my name is Andrade.
Hi, my name is Keilly Lopez. Spasmodic dysphonia. The brief overview. What is spasmodic dysphonia? Spasmodic dysphonia is a voice disorder. This disorder causes involuntary spasms in the muscles of the voice box, also known as your larynx. Due to the involuntary muscle spasms, the voice tends to break, resulting in strangled sounds. It ranges from an individual not having the ability to say a word or two to not being able to communicate at all. The exact cause of this is unknown. However, researchers believe that the basal ganglia of the brain may be to blame. And so now that we have some background information to jump off of, we're going to start answering some key questions in the next few slides. There are three types of spasmodic dysphonia. There is adductor spasmodic dysphonia. This version of the disorder causes the vocal cords to stiffen and slam close due to the involuntary spasm. Speech sounds are usually strained, and this is the most common version. Abductor spasmodic dysphonia. This version of the disorder causes your vocal cords to open during the involuntary spasms. Sounds are weak and breathy. This is the less common version. And mixed spasmodic dysphonia is the very rare version. It is just a mixture of both the adductor and abductor spasmodic dysphonia. So, who does it typically affect and how is it diagnosed? Well, I found an overview posted by Cleveland medical professional mentioned that spasmodic dysphonia can affect anyone. It is known as a rare medical disorder found in 4 people for every 100,000. The first signs appear in people between ages of 30 and 50, usually affecting women more than men. In the same article, it discussed how it's actually hard to be diagnosed with this disorder. Because the symptoms are very similar to other voice disorders, you can be diagnosed after careful examinations done by an otolaryngologist, a speech-language pathologist, and a neurologist. The otolaryngologist examines the vocal folds and the speech-language pathologist evaluates the voice symptoms, whereas the neurologist evaluates the patient for other signs of muscle movement disorders. Okay, so personally, I got very curious about this and I wanted to see real patients or real people who live with this disorder. So I found this video and it was very interesting. I'm not going to play the whole clip. However, I am going to just show portions to get a visual and auditory representation of what spasmodic dysphonia is.
I have the rare version, the AB or the abductor version. My vocal cords stay open rather than open and shut, and I sound breathy quite frequently. He saw a shape mystically cross 50 or 60 steps in front of his sister Kathy's house. I have A, B, and AD, and I also have tremor. So whatever you can possibly get as far as SD, I have it. Early one morning, a man and a woman were ambling along a 1-mile lane running near Rainy Island.
Early one evening, a man and a woman were rambling along a 1-mile lane running near.
So that video is very interesting actually, and I totally recommend it. I have provided the link in case anyone is interested in watching it.
The larynx in the laryngeal system. The larynx serves to produce speech and allows air to pass into the lungs while blocking food and drink from entering. The larynx, also known as the voice box, is part of the respiratory tract, which is a flexible light tube where air passes through the pharynx and the trachea. The larynx is very important because it protects the lower airways and facilitates respiration. It also plays a key role in phonation. Functions of the larynx. One function is speech production. The larynx is comprised of two pairs of vocal folds. Vibrations of the vocal folds allows us to speak and sing, and changes in the vocal folds speeds and tension can vary the pitch. Another function is challenging food into the digestive system. When food is swallowed, the epiglottis covers the opening of the larynx to keep food and drink from entering the airway. The larynx also can help prevent choking. The last function of the larynx is the air passage into the respiratory system. The larynx helps provide smooth passage of air from the nasal cavity to the lungs. If the sensors in the larynx detect foreign particles that could damage the airways, a cough reflex is stimulated. And if the body needs more oxygen, the vocal cords open more widely during inhalation.
So the vocal cords are located in the glottic region of the laryngeal cavity, and they're attached posteriorly to the arytenoid cartilages, and they lie superior to the trachea and inferior to the ventricular folds, which are also known as the false vocal cords. The epiglottis acts as a lid and closes over the vocal folds when we swallow, and the epiglottis can be seen in this picture right here, superior to the vocal folds. The vocal folds move towards the midline when they adduct and close the glottis during speech, and when they're abducted or they're moved away from the midline, they open the glottis. At rest, they lie somewhere in between where they're not fully abducted at the paramedian position. The cricoarytenoid joint is articulated between each arytenoid cartilage, and it allows the arytenoids to rotate and glide, which thus allows the vocal folds to adduct and abduct. The cricoarytenoid joint allows the vocal folds to lengthen, which tenses it, which is vital for adjusting vocal pitch. So how do the vocal folds vibrate? The vocal folds are a crucial part of the phonatory system. Expiration of air is used to vibrate the adducted vocal cords to produce voicing for speech. So basically, expiration leads to vibration of the vocal cords, which leads to sound, which then goes to the articulators and the process of articulation, and this all leads to speech. When expired air from the lungs advances towards the larynx, the vocal cords adduct and block the approaching airstream. This adduction means that vocal cords create a barrier, and so the exhaled air is blocked within the subglottic space below the vocal cords. The expired air continues to build in the subglottic space the more we exhale, and it creates pressure against the vocal cords inferiorly, and this is known as the subglottic pressure. The subglottic pressure eventually overcomes the resistance of the vocal cords, and the vibration cycle begins. The vocal folds in the process of phonation. The process of phonation has two phases, the prephonatory phase and the attack phase. During the prephonatory phase, the vocal folds move from the abducted position to a nearly adducted or a fully adducted position towards the midline. And the prephonatory phase involves the vocal fold approximation and medial compression. And the attack phase, which is the second phase of the process of phonation, starts when vocal folds are abducted either partially or completely, and it continues on to the initial cycles of vibration. And this attack phase involves the Bernoulli effect and the initiation of phonation. And once the vocal folds are abducted, they have the capacity for phonation. And there are two theories of phonation, which are part of the attack phase, and those are the myoelastic aerodynamic theory and the cover body model. So pitch and intensity, the pitch changing mechanism as it relates to the vocal folds. Higher pitch means increased length of vocal folds, increased tension, and decreased mass. And lower pitch means that the vocal folds are decreased in length, decreased in tension, and increased in mass. And the intensity changing mechanism, with increased intensity comes increased subglottic pressure and increased medial compression, and decreased intensity involves decreased subglottic pressure and decreased medial compression. And I just have a diagram right here showing one cycle of vibration.
How spasmodic dysphonia affects the normal physiology and function of the phonatory system. The physiopathology of spasmodic dysphonia is not well understood. and there's a general lack of scientific consensus on the diagnostic criteria. This stems from the fact that some voice disorders may present similarly. Spasmodic dysphonia and muscle tension dysphonia are very similar and can be confused for each other. Spasmodic dysphonia doesn't respond to voice therapy alone. It is task dependent, and the severity of voice systems vary, and speech sounds, unlike muscle tension dysphonia. There are two theories regarding the cause of spasmodic dysphonia. One states it is psychoneurosis, or a conversion reaction, meaning the patient converts a mental problem into a physical one. The other believes it is a disease that affects the normal process of the central nervous system. Evidence suggests spasmodic dysphonia can either be a disease that produces continuous spasms of the larynx, or a more general issue that affects normal movement of the soft palate, tongue, hypopharynx, and the larynx. Spasmodic dysphonia can be comorbid with voice tremors. Patients with spasmodic dysphonia may also present with abnormal movement of the larynx and pharynx during quiet respiration and contextual speech. The disorder can present in a patient primarily as tremor-related or as a presentation of muscular dystonia. According to video fiber optics, laryngoscopy, and video fluoroscopy, studies of patients with spasmodic dysphonia, the abnormalities in the phonatory system for each type are: for the adductor type, on the anterior portion of the ventricular folds, the anterior portion of the ventricular folds are more prominent, with the spazzing of true vocal folds. There's a very tight compression of the vocal folds, strong enough to produce a resistance for and stop the exhaled air. This stops the vibration of the vocal folds and therefore stops phonation. This occurs with words beginning in vowels like egg, or vowels in the middle of words like day. Spasmodic dysphonia abductor type is uncontrolled spazzing of the muscles that open the vocal folds, results in a burst of breath when attempting to start phonation after the production of voiceless consonants, such as the ones right here. Here is a picture of laryngeal spasms with no abnormal movement in the tongue, palate, or hypopharynx. The first one shows the glottis during quiet breathing, the adducted vocal folds during contextual speech, the beginning of the laryngospasm with increased prominence of the ventricular folds, and then during the laryngospasm with complete closure of the vocal and ventricular folds. And this is a patient with tremors during quiet respiration. You can see the open glottis, the start of the tremor, during the tremor, the end of the tremor, and then the open glottis again.
So, how spasmodic dysphonia affects phonation? Spasmodic dysphonia affects a person's vocal cords. The vocal cords use expired air to vibrate and create sounds, which can then be articulated for speech. Therefore, spasmodic dysphonia affects phonation. Spasmodic dysphonia causes a person's voice to be inconsistent and unreliable. Many people with spasmodic dysphonia would characterize their voice as generally unpleasant, raspy, crackling, shaking, hoarse, having a tremor, quavering, screeching, lacking projecting, and containing voice break, spasms, or tension. So, how spasmodic dysphonia affects respiration? The laryngeal system includes a connection for the air used in respiration. The larynx is superior to the trachea and inferior to the pharynx. Within the larynx is the voice box, or the vocal cord. The vocal cords are affected by spasmodic dysphonia, which in turn affects respiration. In order to create speech, a person needs to be able to breathe and use the expired air to vibrate the vocal cords. With spasmodic dysphonia, many people feel that there is a physical effort in talking. The physical effort felt is a result of the sensations of tightness, tension, and constriction. Some of the symptoms that people with spasmodic dysphonia feel with the physical strain include fatigue, running out of breath, and physical tension. People feel drained and exhausted after prolonged speech. As they are talking, the air is being forced out and takes extra effort to come out. Effortful speech is the most commonly reported symptom for spasmodic dysphonia. So here are more real situations with spasmodic dysphonia and respiration. So some people characterize their voice as having it feels like you're having to grab onto the words and push it out from your throat. There's a rubber band around my neck. Someone was constricting it. I was trying harder and harder to overcome and produce a good quality voice. It was taking more and more effort. I was just getting on a vicious cycle. It feels like you have a sore throat all the time, like a raw feeling in your throat. The ways spasmodic dysphonia can affect a person's life. So the communication-related quality of life, the QOL, contains 3 factors: physiologic, personal, and social. So the physiological aspect includes the voice quality, effort, and voice dependability. The personal aspect includes affective responses, changes in self-view, and coping strategies. The social aspect includes physical environment, other people, and participation in social roles. So spasmodic dysphonia can affect all three of these aspects, and it's different for every person. Here are examples of ways that spasmodic dysphonia can affect one's life. So there's the psychological. So that could be having a poor and inconsistent vocal quality, voices are weak and hoarse, and there's a physical strain to talk, which can lead to fatigue and feelings of breathlessness. Another way is personally. So it could be changes how a person feels about themselves. It can cause feelings of hopelessness, embarrassment, frustration. There's a mismatch between the personality of a person and their voice. And there are 3 coping mechanisms that include treatment, avoidance, and attitudinal coping. And the third way spasmodic dysphonia can affect one's life is social. The biggest issue that they have is speaking with background noise or on a telephone. It can cause people to quit their jobs or even turn down new opportunities. Familiar people try to facilitate participation and accommodate for communication challenges, but unfamiliar people are less patient and less accommodating, and they are concerned about being ridiculed or ignored in conversations or situations. And here are actually some tips that have been put out for people with spasmodic dysphonia when they're in social situations to help them feel more comfortable.
But just to start out, there is currently no cure for the disorder, but there are several different treatment options that can help patients with the disorder to lessen their symptoms. The first one I'm going to go over is speech and voice therapy, and this is basically just when the patient would work with a speech-language pathologist in order to learn to adapt to the spasms and control the way that it affects their speech. So in doing this, they would be taught to alter their airflow when they're speaking, or they can be taught to soften their voice a little bit, just so that their voice would come out smoother when they're speaking. Another treatment option for those with spasmodic dysphonia is the use of oral medications. And this is typically a pretty uncommon way to treat spasmodic dysphonia just because the relief is very temporary. There aren't any specific medications that are currently approved by the FDA to treat spasmodic dysphonia, but there are certain medications that do work to temporarily relieve the symptoms. These are typically muscle relaxers like Artane or Balcafen, and these work by relieving the symptoms by temporarily relaxing the muscles that are affected by spasmodic dysphonia. The next treatment option I'm going to go over is the use of botulinum toxin, which is also most commonly known as Botox. And this is when a doctor would go in and they would inject Botox directly into either one or both of the vocal folds, which would result in smoother speech. When they inject the Botox, basically this weakens the muscles of the larynx, which would reduce the spasms that the individual is experiencing. This is the most common treatment for spasmodic dysphonia. The only drawback of it is that re-injections are needed to maintain the results. And typically, each injection lasts around 3 to 4 months just before the patient will start to see their symptoms begin to return. Unfortunately, Botox injections don't work for all patients, and they have shown to be much more effective for adductor spasmodic dysphonia than those with abductor spasmodic dysphonia. The last treatment option I'm going to go over is the use of surgery to treat the disorder. Prior to the use of Botox for treatment, surgery was the most common treatment for spasmodic dysphonia. However, since there have been several treatment options developed in recent years, surgery is typically a last resort. This would only be used if a patient had experienced no relief from any other forms of treatment. And in the surgery, the surgeon would go in and make an incision in the patient's neck in order to expose the muscles and nerves of the larynx. And they would then sever the nerves and redirect it so that the spasms were no longer occurring in the larynx. Currently, there is no cure for spasmodic dysphonia, as I stated earlier, but as you can see, there are several different treatment options for those that suffer from the disorder. No comparative studies have been conducted that show a single best treatment, but individuals suffering from spasmodic dysphonia do show different outcomes for almost all treatments. meaning that what treatment is best for an individual completely depends on the patient themselves, and they might have to try out several different treatments, if not all of the treatments, in order to find out what's going to be best for them. In some cases, patients might not respond at all to any treatments, and in this case, some people might find it helpful to seek help from a psychologist where they can learn to live with the symptoms that they experience.